Today, millions of Americans struggle to pay outrageous prices for medications and medical supplies. Many patients can't afford their prescriptions, and some doctors can't even obtain basic supplies. Doctors and their patients are being forced to use less effective and sometimes less safe medications and supplies due to astronomical cost and lack of availability. These shortages and the exorbitant prices of drugs and medical supplies are the result of a legalized form of racketeering promoted by government-sanctioned kickbacks. How in the world did we get here? At the center of this issue are GPOs and PBMs, the middlemen responsible for this mess. GPOs, or group purchasing organizations, began as buying co-ops. They purchased in bulk and negotiated discounts from drug manufacturers and medical supply vendors on behalf of hospitals. In return, hospitals paid dues to the GPO to cover administrative expenses. Similarly, PBMs, or pharmacy benefit managers, were formed to help insurance companies manage their medication benefit more efficiently. The advantages hospitals and insurance companies gained by working with GPOs and PBMs outweighed the fees they paid. Unfortunately, this began to change when a law was passed that allowed the middlemen to take kickbacks from manufacturers and supply vendors in return for exclusive sales contracts. This legislation permitted a steady transformation from the cost-saving co-ops into a corrupt pay-to-play scheme. Today, a handful of greedy middlemen control access to nearly the entire healthcare market for drugs, medical devices, and supplies. Manufacturers who pay the largest kickbacks are given the biggest contracts for their products, even when less expensive or better options exist. Manufacturers unable to pay these enormous fees find it difficult to sell their products at all. By determining which suppliers receive contracts, middlemen stifle competition, the free market, and any chance of a level playing field. To make matters worse, manufacturers and suppliers must continually increase the price of their products just to cover the kickbacks they have to pay to the corrupt middlemen. And those increased costs, they get passed directly on to the patients who can least afford to pay them. It's a cozy little scheme. Patients need treatment, doctors and hospitals treat them, while greedy middlemen make all the big money controlling critical medications and supplies like back alley dealers. A clear example can be seen with insulin pricing. Rather than pay $100 per month, patients with diabetes are forced to pay $400 or more per month. The extra $300 goes to pay the kickbacks demanded by the middlemen. To put this in perspective, if your morning coffee were sold like pharmaceuticals and medical supplies are today, your $5 latte would cost you $20. This corrupt and unethical practice is essentially racketeering. It's illegal in any other industry, but is protected in healthcare by inflationary, unfair, and downright dangerous government-approved kickbacks and profiteering. These unethical government-sanctioned kickbacks have also resulted in critical drug and medical supply shortages. Hundreds of essential drugs are in dangerously short supply because many suppliers have discontinued production or even gone out of business because they couldn't pay the fees demanded by the middlemen. It's time to end this corrupt system of payoffs and kickbacks. It's time to eliminate the greedy middlemen and let the free market do what it does best: reward quality, efficiency, and competitive pricing, not those who have their finger on the scale. To learn more about the dangerous impact of the so-called safe harbor and what you can do about it, visit the website on your screen. If Americans truly want healthcare reform, let's begin in the middle. Repeal kickbacks now.